Hi, good afternoon, FirstLight family. This is Paul Jones coming back to you with our weekly coronavirus update. And here's what you need to know. The first thing I want you to remember is our website. That's where we're going to update information in between videos. And so the latest information that we have on Virginia, what's going on nationally, is going to be posted there. Just go to woodbridge.firstlighthomecare.com, click on the banner at the top, and it will take you straight to our coronavirus updates page, where you'll learn all about how we're continuing to manage the public health crisis, and other information that we want to share with you is going to be there. Second thing is, I want to make sure all of you are aware that we are continuing to follow the CDC guidelines. I've shared with you our infection control plan and what those CDC guidelines are, but any national guidelines or Virginia guidelines is what we're following. How does that impact you? Well, the first thing you should know is that all of our caregivers are screened every day to make sure that they are symptom-free. Anybody that's reporting any of the classic symptoms related to the coronavirus, particularly temperature, cough, shortness of breath, any of those things, we're removing them from the schedule and making sure that they are not coming into your homes or to the homes of your loved one. Thus far, we have had 0 incidents of any symptoms being reported here at FirstLight. In addition to that, you need to know that the most reliable way to protect both our caregivers and you from the virus is the mitigation factors from the CDC. And that consists of washing your hands, which we are continuing to do. It's not that we didn't wash our hands before, but we're doing it more frequently. So before we come into your home, more often while we're there, if we're doing any personal care, and then before we leave. And then lastly, I want to talk to you about masks. There's a lot of confusing information out there about masks. I have one here. It's a cloth mask. Actually, one of our caregivers, Patricia Cooney, made these for us. Mine is a unicorn mask. And if I were to put it on, this is how it would work for me. Now, the reason I would wear this at all is to protect you from me. If I were sick, I would put this on. The mask is designed to keep whatever's in here going out and affecting you in some way. And so you're not seeing our caregivers wear these for the most part because they're not sick. The only caregivers that would wear them is if you have requested that specifically. We do have a supply. The supply is very limited, however, because there's a shortage, as I'm sure you know. But we're working on that, and we have enough right now to meet the need. But right now, that is the CDC guidance on using masks. They're really for sick people. So we're not using them until someone is sick. And again, if a caregiver's sick, they're not going to be coming to your home anyway. If you have questions about that stuff, you can call the office, you can talk to me or Matthew or Leanna anytime, and we'll be happy to help. The last thing I want to talk to you about is the governor's stay-at-home order that right now is in effect until June 10th. And what does it mean? Well, it's simply put, stay home. The only exception to that would be with your caregiver. We have a very limited number of caregivers who have very specific instructions around care plans to take their clients out of the home. They're not going to go to public places. They're just going to be to get some fresh air and use social distancing and good hand hygiene when they're out in the public. But we're asking you as family members to please not visit your elderly loved ones and to please not take them out of the home. It's for their best interests. If you're worried about them being stuck inside, please give us a call. And related to that are essential items that you need, like groceries, things like that, personal items, prescriptions picked up. We have a contactless delivery system where we will go out, pick up what you need, bring it to your home, and you don't have to interact with us in any way if that's a concern. We're not only doing that for FirstLight clients, we're doing that for anybody in the community that might need an extra hand. So if you know somebody that needs help around that, give us a call. Please let us know. We'd love to help. Those are the main things I wanted to update you on this week. We continue to be here for you 24/7. We're just a phone call away. Our phones are still answered by a live person during all of this, and we are here to help. I'll keep coming back to you, hopefully every week, and sharing updated information as I have it. Thank you for placing your trust in FirstLight. Stay well, stay safe, and stay home. I'll talk to you later. Bye-bye.